Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Look, I did a video on this on Sunday. It's gotten some traction, but I wanted to do another video on it, and it is about how the VA has made an agreement with multiple civilian, non-government medical providers for data sharing. And my question here, I'll front load it with this, is do you think that the VA is going to reach out to these new partners and say, hey, I have John Doe, birth date X and social security number Y. Do you or have you ever seen this person? And if so, oh, by the way, send us all their information because we're in this agreement now. It just kind of feels weird if that's how this can happen. And the reason why I'm saying that is because I don't recall ever hearing anything about this from the VA. I don't recall being asked if I want to participate in this data sharing stuff. How are they going to know if I'm being seen by one of their partner gigantic medical installations? So like Kaiser Permanente, I believe, is one. So how do they know if I'm being seen there by a private doctor or not? How are they going to be able to share my information with them or not? Somebody's got to tell somebody something. And they're not asking me, the veteran. So are they going to ask each other? I'm kind of confused a little bit on how that's going to happen. And I'll also put this out there. There's two ways you could look at this. Obviously, like everything. And then there's the truth, right, is somewhere in the middle, right? So one way is this is a fantastic thing. It's going to catch things up front. The thing that somebody saw here that somebody missed there, and then this and that, and they saved your life, and everything's great. And then you were able to get a higher VA rating on top of all that, right? That's one side. The other side is, well, I never knew that any of this was happening. I really wasn't thinking, and I just said, yeah, I'm feeling great. And, no issues. And what I meant to say was no issues today with that problem, but it's every other day, so no issues today. But I didn't clarify because I didn't think I was, putting myself out there. But now, because I said that, they put it in writing that, oh, he's magically better and he's healed, And so now, all of a sudden, the VA's calling me in for a follow-up C&P exam because they want to reduce my rating. There's the other side, right? So I'm just a little bit fuzzy about how all this is feeling. And of course, the way that they make it sound is that it's going to be great. But I don't know. Call me skeptical. So I'm going to read kind of some of this that I did in the video on Sunday. I'm just hoping that more people get this information and are aware. So this is from the Federal News Network, and it says here on the headline, VA makes data sharing pledge for seamless veteran health care across 13 healthcare systems. That's a lot. So hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. I just want to make sure, again, that this information gets out there because, I don't know. To me, I think we should know, and that's why I'm doing this, and that's why I'm doing this twice, and it might irritate some people that it's the same information, but here we go. The Department of Veterans Affairs is sharing more of its data with non-VA medical providers and vice versa to improve health care for veterans wherever they seek help. Okay, well, the end of it sounds really nice, but this part about is sharing more of its data. The VA is sharing more of your data with non-VA medical providers and vice versa. Non-VA medical providers that you see are sharing your information with the VA. Did you know? I mean, I don't know. I'm finding out now, right? Well, I found out on Sunday. So the VA announced on Friday it's signing a data sharing pledge with 13 community healthcare systems across the country. And if I remember right from Sunday, my memory is about that long, Kaiser Permanente is one of them, which is a huge healthcare system, right? So just to kind of highlight with that, let's move on. Private sector clinicians with access to VA data. Private sector clinicians with access to VA data under this data sharing pledge can identify when a patient is a veteran. So how? So this data sharing pledge does what? Hey, we're the VA. We're going to let you know all of our veterans. And then it'll pop up that your patient is a veteran. Or, fine, the clinician can take your information, plug it into a special portal into the VA's world, and then VA is going to say, yep, that's a veteran. So that's probably the way that they're going to do it. So private sector clinicians with access, right, to the VA data, so they have access into a special portal, is what I'm envisioning, under this data sharing pledge can identify when you as a patient walk in, they can identify if you're a veteran more quickly because they can just go straight into it. Instead of asking you, hey, are you a veteran? Nope, that's not good enough. Let's data share, right? Let's share that information. Let's suck it in from each other and share this important information. And I wonder if your doctor's going to have you sign anything, or if you even are going to know that they're doing this. It's kind of crazy to me. I don't know. I'm a bit more on the privacy side myself, and if I want to give you something, I'll give it to you. And if I don't want you to have something, I'm not going to give it to you. How about that? So those days look like they're gone. VA officials told Federal News Network that the data sharing pledge is a step to ensure veterans receive seamless health care between VA and non-VA providers. So I'll put it to you this way. Many people, veterans, who don't go to the VA for everything aren't going there on purpose. Either they don't like the service they got at the VA and they want to go down the street to their provider and get seen there. They want it to be separated. Many. Now, of course, there will be positives. Of course there will be. There would be positives to having those two things happen. You got two healthcare providers that are working for you. You jump from one to the other and so forth. But I think, and this is what I said on Sunday, I think that this should be something that we, the veterans, should be well aware of and should be afforded the opportunity to opt in or out of this pledge, right? This should not be something that the VA just gets to do because they feel like it, right? I get it, but at the end of the day, it's me, it's my personal choices with what I'm doing with my healthcare. So, and look, I'm not mad at somebody who wants to opt in. I'm mad at not being given the option, right? So there's going to be plenty of reasons why people are going to want to opt in. Thousands of reasons people would want to opt into this between their providers, obviously. But don't you think they should know? And now I might be putting the cart before the horse here. I don't know. But it seems like this is a big deal. And it seems like I don't know about it from the VA. So it seems a little bit weird. All right. VA officials, I already said that they're to make it seamless healthcare between the two types. So we're hoping we're going to help the community provider understand and recognize when that patient in front of them is a veteran. And that's not something that we really do today. The VA official told the Federal News Network. So again, every doctor's office here, if they wanted to, know if you're a veteran, could add that to their new patient checklist, right? Your sex, your birthday, you're this, you're that, are you a veteran? Are you this? Are you that? Right? And some of these doctors know you're a veteran because you tell them anyway, because, yeah, I hurt my this when I was in the whatever, right? So I don't know how much it really matters. All right, Undersecretary for Health, Sharif Ellenhall said in a statement, pledged to improve the health care by giving seamless blah, blah. Keeps going on. I'm trying to find the spot here where there was a list. They had several of them listed of the different organizations like Kaiser, right? So let's see. So most non-VA medical providers rely on patients to self-report their veteran status and may miss the opportunity to tell a veteran about VA-covered health care and benefits they're eligible to receive. So that's weird to me too. How many times do you think you're going to walk into a doctor's office that you are the paying patient? They make money because you're there. And they're going to go, hey, look, you don't need to come here and give us money. Go over there and go do it for free. No. Hey, we love having you for a patient. We want you to be here. We want you to spend money. In fact, can you make it back next week for a follow-up, right? So I put it in the eyes of a business owner for 1 minute, right? Especially if it's a smaller practice, right? So now that you know this patient is a veteran, what can we do? What can we help with? How can we make this a better experience for the veteran and the provider? The VA official said. VA officials told Federal News Network all veterans can benefit from greater data sharing between department and community care providers, but it will especially help the VA reach out to veterans diagnosed with toxic exposure conditions covered under the PACT Act. The PACT Act extends access to VA health care and benefits to veterans exposed to toxic burn pits during their military service. So, again, if they're trying to just do some sort of outreach, in my opinion, print out hundreds of thousands of little pamphlets that talk about the VA and veterans and toxic exposures and free health care and blah, 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 and give them to all the doctors' offices to sit out in their little lobbies with their little books and magazines, right? Or do a better job at out processing, right? When you're leaving the military. I'm a little bit, irritated with this for some reason. So VA officials said that, for example, a veteran recently separated from military service could get diagnosed with a lung cancer at a non-VA hospital and may not realize that the cost of her cancer treatment is covered within the VA medical system. It doesn't occur to her that she could get care from the VA. So she stays within the private industry. Of course, she's responsible for all those costs. So unless she comes back into the VA for treatment, she will carry that financial burden, the VA official said. That's really the conversation. You have a presumptive condition that's covered under the PACT Act. Have you talked to the VA about it? You could be receiving care at the VA at no cost. So, again, inform the medical community of this for when they run into people who can't afford it, they can then leave, right, and go there. Why do you need to share all the data, right? So if you're relying on the medical providers to share that, it's kind of like, well, I don't know. The VA PACT Act goes on to talk about that, which we all know a lot about at this point. The data sharing pledge can help non-VA clinicians inform veterans about their VA. Really? So, again, look, I show up on time for a medical appointment at a non-VA medical, right, appointment, any VA appointment, any medical appointment, but whatever, non-VA medical appointment, and I'm on time. Doctor's late, they're behind, they're busy, they got a lot going on. They're trying to make money and pay their bills and all that good stuff, and it's a conveyor belt. I get it. So here we go. The VA states here, basically, that the data sharing pledge can help non-VA clinicians inform veterans about other VA programs, such as assistance for veterans experiencing food or housing insecurity. I don't know. As much as I would love for that to be the case, I truly would. Hire somebody for each one of these places to sit there and just walk around and ask people if they're veterans, and then sit down with them and explain to them what sort of opportunities are with the VA, and ask them about their life situation. Are you good financially? Do you have any sort of issues? Is your housing stable? Do you I don't know. Yes, that sounds great. Do I think that that's going to happen? No, I do not. So here I finally found it. If you hung on for this long, it's mostly me just bitching at this point. The following healthcare systems are participating in the VA's data sharing pledge. Maybe I'll do another video since this is now 16 minutes. I'll do one other one that just says this. All right. The following healthcare systems are participating in the VA's data sharing pledge: Emory Healthcare, Innova, Jefferson Health, Sanford Health, UC Davis Health, Intermountain Health, Mass General Brigham, Rush Health, Tufts Medical Center, Marshfield Clinic, Kaiser Permanente Health Plan and Hospitals, UPMC, and Atrium Health. So, they're all in a data sharing agreement with the VA, or they're going to be, and basically they're going to plug your information in when you go there into a VA portal, probably, and bam, yes, you're a patient of ours and you're a patient of the VA's, and the information will be sucked back and forth. Wonderful. That's it. Thanks for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.